Assalamualaikum Dr. Awad. I'm Masturina Rasyiqah, a final year Bachelor of Pharmacy student. Today, I'll be presenting our assignment titled Understanding How Medicines Are Used, a comprehensive review of utilization pattern, ATC-DDD system, and patient medication behavior. With that, I'll begin. Today, I will introduce the foundation of my report, which focus on how medicines are actually used in real-world healthcare. Drug utilization studies, as defined by WHO, examine the entire journey of medications, from prescribing to patient use, and help us understand their medical, social, and economic consequences. Studying medication use patterns is crucial because it allows us to detect irrational prescribing, monitor adherence to guidelines, and support national policies such as Malaysia's National Medicines Policy. This introduction also highlights key pharmacoepidemiology tools such as drug utilization review and drug utilization evaluation for evaluating appropriateness, the anatomical therapeutic chemical ATC, and defined daily dose DDD system for standardized measurement, and patient level indicators like adherence, persistence, and polypharmacy. The aim of my report is to integrate these frameworks to show how they collectively identify irrational medicines use and reinforce the critical role of pharmacies in ensuring safe, effective, and evidence-based medication utilization. Medication utilization patterns refer to how medicines are prescribed, dispensed, and used across a population, and the WHO emphasized that this includes the medical, social, and economic consequences of drug use. Analyzing these patterns is essential because it helps us detect irrational use such as overuse or misuse, control healthcare costs, and evaluate whether national policies and formularies are effective. It also strengthens pharmacovigilance and public health surveillance, especially when monitoring antibiotics, psychotropics, or high-risk medicines. For health systems, these studies guide resource allocation and reduce adverse drug events. In Malaysia, the National Medicines Use Survey and MUS use the ATC-DDD system to track medicines consumption nationally, making utilization patterns crucial not only for patient safety but also for national healthcare planning. On this slide, I'm highlighting the core concept of drug utilization review and drug utilization evaluation. DUR is a broad, continuous review of how medications are prescribed and used, while DUE is a more focused evaluation of a specific drug or class based on defined clinical criteria. Their differences lie in the scope and purpose. DUR looks at overall patterns and prevents medication-related problems, whereas DUE ensures strict adherence to treatment guidelines. DUR has three main types: prospective, which is review before dispensing; concurrent, which is review during therapy; and retrospective, which is review after use. Ultimately, both DUR and DUE are essential because they improve patient safety, promote rational medicines use, and support cost-effective therapy. Pharmacists play a central role in this process as the key gatekeepers of medication safety. On this slide, I explain the ATC-DDD system, which is the global standard used by WHO to measure and compare medicine use. ATC classifies drugs in 5 levels, from the organ system down to the specific chemical substance, allowing very detailed analysis. The DDD represents the average adult maintenance dose, and when expressed as DDD per 1,000 inhabitants per day, it enables fair comparisons across countries, hospitals, and over time. This system is crucial for identifying trends such as antibiotic overuse, guiding national surveys like Malaysia's National Medicines Use Survey, and supporting rational prescribing as well as health policy decisions. While it is standardized and widely accepted, it doesn't reflect individual patient dosing, which is one limitation to consider. On this slide, I summarize the 3 key concepts: adherence, persistence, and polypharmacy. Adherence refers to whether patients take their medication correctly, while persistence focuses on how long they stay on therapy. Polypharmacy, usually 5 or more drugs, can be appropriate but also increase risk like interactions and adverse reactions. We assess adherence using methods such as MPR, which is medication possession ratio, PDC, which is the proportion of days covered, pill counts, electronic monitoring devices, and self-report tools like 8-item more risky medication adherence skills, or Malaysia's MyMed, which is Malaysia Medication Adherence Assessment Tools. To improve outcomes, pharmacists play a major role through counseling, MTech programs, digital reminders, and de-prescribing using STOPP or START, stop, start, or BEARS criteria. Through these strategies, we enhance patient safety and optimize therapy. On this slide, I discuss how integrating DUR, DUE, and the ATC-DDD system strengthens rational medicine's use. First, DUR and DUE help detect irrational practices such as duplication, interaction, and non-guideline prescribing, while ATC-DDD provides measurable evidence of overuse or underuse. Second, assessing adherence and polypharmacy is crucial for safety because poor adherence drives treatment failure, and unmanaged polypharmacy increase EDRs. Programs like MTech play a major role here. Third, pharmacists are central in interpreting DUR data, applying ATC-DDD findings, counseling patients, and reporting to NPRA. Finally, when these components are integrated at the health system level, they improve resource use, strengthen policies, and support real-time surveillance for better population health. In conclusion, drug utilization studies are a core pillar of pharmacoepidemiology because they show how medicines are truly used in real-world practice. Through tools like DUR, DUE, and the ATC-DDD systems, we can identify irrational drug use and measure consumption objectively across populations. In Malaysia, these evaluations directly strengthen DUNAS and support rational medicine's use. By assessing adherence and polypharmacy, we focus on patient safety and treatment optimization. Here, pharmacists play a central role, leading DUR and DUE activities, running MTech service, and monitoring adverse reactions. Overall, drug utilization studies improve outcomes, reduce healthcare costs, and protect patient safety. Ultimately, these systems ensure medicines are used rationally, safely, and effectively. That's all from me. Thank you.